How do IGRA tests diagnose latent TB? Have you ever wondered how doctors diagnose latent tuberculosis infection? Interferon-Gamma Release Assays, or IGRAs, play a crucial role in this process. These tests measure how your immune system reacts to specific proteins from Mycobacterium tuberculosis, the bacterium responsible for tuberculosis. When someone is infected, their immune T cells recognize these proteins and releases a signaling protein called interferon-gamma. The IGRA test detects this releases from your blood cells after they are exposed to tuberculosis-specific proteins outside the body. Here's how it works. First, a blood sample is taken from the individual. This sample is then mixed with tuberculosis-specific proteins and controls. These proteins are unique to Mycobacterium tuberculosis, which helps improve the test's accuracy. If the immune system has been sensitized by a previous infection, the T cells will recognize the proteins and releases interferon-gamma. The test measures the amount of this protein released, indicating an immune response to tuberculosis. A positive IGRA result suggests that the immune system has encountered Mycobacterium tuberculosis, indicating a latent infection. However, it's important to note that the IGRA cannot differentiate between latent infection and active tuberculosis disease. Therefore, it should not be used alone to diagnose active tuberculosis. One of the advantages of IGRA tests is that they are not influenced by prior vaccination with the Bacillus Calmette-Guérin vaccine, unlike the tuberculin skin test. This makes IGRAs particularly useful in populations that have received this vaccine. There are two main IGRA tests used in clinical practice: QuantiFERON-TB Gold Plus and T-SPOT.TB. Both tests assess the releases of interferon-gamma but use different methods to do so. While IGRA tests are generally accurate, they are not perfect. They have good specificity, especially in low-risk and vaccinated individuals, but neither IGRA nor the tuberculin skin test can predict who will progress from latent infection to active tuberculosis. In summary, IGRAs diagnose latent tuberculosis by detecting the immune system's releases of interferon-gamma in response to tuberculosis-specific proteins in a blood sample. This immune response indicates prior exposure to Mycobacterium tuberculosis, consistent with latent infection. However, further clinical evaluation is necessary to rule out active disease and determine if preventive treatment is needed. Always consult with a healthcare professional for personalized medical advice regarding tuberculosis testing and treatment.